I talk like this. Welcome to the Pearlii podcast. Okay, welcome to another episode of the Pearlii podcast. We have a very special guest today, a friend of mine, Dr Jalal Khan. Just an all-around wonderful human being. Jalal, thank you so much for coming on to the Pearlii podcast.
Thanks so much for having me, Carl.
And this is an easy show for you. The show is all about you and the amazing work you're doing in the community through the dental station. Can you just tell us a little bit about who you are, like your private practice, and then we can maybe hear about how you came up with the idea for the dental station?
Sure. So, it's not necessarily all about me. It's about the people that we look to help. But very kind of you to say that. The dental station was originally an idea where we would set up multiple stations around Australia that could be a one-stop shop for dentistry for those in need, not necessarily just in the private practice, but also in the charitable space as well. And so we started with the clinic in North Sydney, and the name was the station, with the idea that we'd have multiple stations. And then what happened was I came across a mobile dental clinic, which was really, really cool for me. It's something which I'd always dreamed of doing as a student. And when I came across this, I was thinking, I have to have this. So
it's a truck. You're talking about a mobile, like you can just drive it around. It's got everything you need.
It's got everything on it. It's a fully fledged kind of clinic on wheels, with the cabin at the front where the drivers and the passengers sit. There's space for 5, and then we've got the I guess you can call it living quarters, because it used to be a partial motorhome. So you got living quarters in the middle, and then it used to be used to transport horses in the back. So there was a horse in the back.
This is your truck you're talking about.
Yes.
That's cool.
And this was converted into a dental clinic with the proper setup, like electricals, plumbing, air conditioning, the dental chair, x-rays, digital x-rays as well. So
x-rays within the truck. That's really cool.
Yes, x-rays in the truck. We've got a sterilizer as well. So it's a proper setup, which is why I was comfortable to go ahead and purchase this clinic and take it on the road, because I was then, I guess, confident in the equipment that we were able to do comprehensive care, which is really important. And so one of the dental stations now is this truck, which we call the dental truck, quite simply. And so the dental truck is something which we take out to various areas. So far on the eastern seaboard, we're going to southwest Queensland. We spent a bit of time in northwest New South Wales in a town called Bourke, which most people would know. And every now and then we bring it to Sydney as well. And each time we do it, we're looking to treat communities in need that have poor access to dental care for 2 main reasons. A, it's difficult for them to afford it, or B, there's just a tyranny of distance. They're just so far away from the nearest dentist. And so they may be able to afford treatment, but the nearest dentist might be a 400-kilometre round trip or 500-kilometre round trip.
That's what this is all about. Filling a need. There's people in rural and remote communities have really poor access to dental services. That's what this is all about.
That's what it's all about, really, because we've got a lack of public dental services being provided frequently enough, and what that leads to is a backlog of dental needs, and it's just not being met.
All right. Well, could you tell us like a couple of the stories? What's the first story that springs to mind? Someone that you've helped.
I mean, there are the classic stories of, a gentleman that's been in pain for weeks on end, and then we come and we sort it out for him, and, he's over the moon. But there's 2 that really spring to mind. One is there was a patient that was in palliative care. He was in his 70s, and he knew that he had a few months to live, but he was really struggling to eat steaks and sausages because of the dental pain that he was experiencing in the left part of his lower mouth. And it was really upsetting him, because, he was kind of like, I've got a few months to live, I've got cancer, all I want to do is eat a steak. And so we came into town, as we usually do, because we return regularly to the towns that we treat to maintain a continuity of care. And so he he presented for treatment. He was in a wheelchair, so I kind of helped him to get up into the truck, and sat him down in the chair, and understood more about what he was going through, and took some X-rays, etc. And in about an hour, I was able to do a few fillings for a few teeth, and just give his teeth a general clean, and just get him up and running for I guess the rest of his days. And I mean, he was so happy to just be able to kind of know that he would comfortably be able to enjoy a steak for the rest of his days and have a beer. And that's exactly what he said after I'd finished. He's like, I'm just looking forward to having steaks and beers for the rest of my days. And I mean,
That's
it's
awesome.
something so simple. It only took me an hour, and it was just a really special feeling that I could at least give him some sort of enjoyment for whatever time he had left. So that was really special, and I'll never forget that. And another one, which is really tells the story beautifully about why this type of remote work is needed, is that we're in town, and a young mother came for and she needed a filling to be done. And so we sorted out the filling in about half an hour, 40 minutes or so.
Hmm.
And then I asked her, what does it mean for you to have the dental truck come to you? Because, we're in a town called Quilpie, which is maybe about 950 kilometers west of Brisbane. And she said, well, look, I mean, this filling's only cost me a couple of $100. And so in this instance, it wasn't necessarily a patient that couldn't afford treatment. She was just so far away from the nearest dentist. And so we do kind of offer a fee for service at government rates, so that we can channel the profits back into keeping the service running.
Hmm.
So this young mother, we treated her, and I asked her what it meant to her. And she said, if you weren't coming to town, I'd have to take off 2 days from work, 1 day to travel, pay for accommodation overnight, get my dental treatment sorted, then travel back the next day.
Wow.
Because she can't drive back on the same day, because if she's driving in the evenings, there's a risk of driving and knocking into, well, not knocking, but banging into kangaroos or kangaroo jumping in front of the car. And that's a serious consideration out there.
No, I know. I'm from Dubbo originally, so
There you go.
I love what you're doing.
And so you really only drive out in the daytime. And so she's like, so you've saved me at least $500 in fuel and accommodation and whatnot. And
the stress.
And the stress. And I wouldn't have to organize for babysitting for my 3 kids while I was away.
Wow.
And you just got it done in 40 minutes. Because you came to me. And so that's a beautiful way of kind of painting the picture about why this is needed, and it makes me feel good.
So do you work with a group of dentists that are volunteering like you, or?
So for a long time, it was me that was doing most of the clinical work, but I was lucky to have a great dentist, Francesca Wing, out in the Sunshine Coast, and she hopped on board probably about a year into the piece, maybe about late 2018, and so she's been helping me with the remote work for quite a while, and particularly during COVID, which obviously rampaged through the world in 2020. The truck was up in Queensland, but I'm personally based in Sydney, and so she. Because she was based in Queensland, she didn't have any border issues. So she was able to carry on the work while I couldn't. So I'm immensely grateful to Fran for jumping on board and helping out. She's been so great to keep the service going. She has the same passion that I do about remote dentistry, and she's such a super hard worker as well. So Fran's been a big help for me in the remote setting, and I've got lots of colleagues in Sydney that look to donate a day or so in kind whenever the truck's in Sydney, and we're doing some charitable programs here. So it's nice to have like-minded clinicians getting involved. It helps with the clinical load, and it's a win for all.
That's amazing, mate. You're a special dude. Well, just to finish up, maybe you could tell our listeners about what's next for the dental truck. What would you love to see happen?
Well, for a long time, it's been me personally funding the service, and so I'm really hopeful that one day we'll be able to get some serious funding to promote the service and take it to the next level, which means more clinics and more clinicians helping, and really having multiple locations operating simultaneously, because right now it's just the one truck, and there's a lot of logistical costs in moving one truck from here to there and here to there. But if we can have one in New South Wales and one in Queensland, wouldn't that just be cool? So yeah, the goals are more funding so that we can channel that towards expanding the service and really putting a dent into these the number of people that haven't been able to access care.
Okay, I don't know if you meant that as a pun, putting a dent into dental health.
I didn't actually.
We'll cut that out. We'll cut that out. Or will we? All right, mate. Thanks again for coming on to the Pearlii podcast. You're an absolute legend. Please keep up the great work.
Thanks so much, Kyle.
And to our listeners at home, please be sure to check out other episodes on our Instagram and our website, and download the Pearlii app. Thanks.